Hi, my name's Abby and I'm a student nurse at Cedar Crest College. The overall topic of my poster and paper presented is kangaroo care in preterm neonates. The reason why I chose this topic is because that I'm very interested in becoming a NICU nurse, as well as I'm very interested in kangaroo mother care and how it associates and benefits to the preterm neonate population. First thing I'm going to be talking about is the significance of the problem. Neonates born before full gestational age or low birth weight infants have a higher risk of morbidity and mortality. Edgar Ray was the first to introduce kangaroo mother care in the low birth weight or preterm neonate population in 1978 in Bogota, Colombia. Kangaroo mother care is associated with reduced mortality, increased bonding between the mother and the infant, increasing mother-infant attachment, as well as decreasing hospital stay. The overall clinical question that I posed was, in neonates in the neonatal intensive care unit, does kangaroo mother care compared to standard care improve the overall growth and development of the neonate? As for my search of the literature included in my poster, the keywords used to find my literature sources used and my 3 studies used were kangaroo care, neonatal outcomes, benefits, and neonates. The databases used were EBSCOhost and Google Scholar, and the limitations used to find my 3 studies were the years 2008 to 2016, as well as making sure that they were scholarly, peer-reviewed journals. Overall, 7,061 articles were found and narrowed down to 3 studies. They were narrowed down based on if they answered my PICO question appropriately and correctly, as well as if they were systematic reviews and meta-analyses. Located in the middle of my table is my evidence summary. The first study that I'm going to introduce is by Lawn et al. In 2010. The overall purpose of this study was to assess the effect on neonatal mortality from complications of preterm birth of kangaroo mother care compared to standard care or no care at all. The overall design of the study was a systematic review. The sample included 15 studies, 9 were randomized control trials, and 6 were observational studies. The overall result of this study was that it was the first published meta-analysis showing and connecting kangaroo mother care to reduce neonatal mortality, as well as it also found that it was highly effective in reducing morbidity linked to infections. The second study introduced was by Conde Aguadelo et al. This was in 2012, and the overall purpose of this article and study was to determine whether or not there is enough evidence to support the use of kangaroo mother care in low birth weight infants as an alternative to conventional care used in hospitals today. The overall design of the study was also a systematic review. The sample included 2,518 low birth weight infants despite their gestational age. The overall results of the study were that kangaroo mother care is associated with a reduction in the risk of mortality, infection, sepsis, hypothermia, and also linked to a decrease in hospital stay in preterm neonates. Also was that kangaroo mother care increases infant growth, it increases successful breastfeeding of the infant and the mother, and also increases mother-infant attachment. The third study introduced in my evidence summary was by Boundy et al. In 2015. The overall purpose was to estimate the association between kangaroo mother care and neonatal outcomes. The design was also a systematic review, and the sample included 124 studies that met inclusion criteria. The result was that kangaroo mother care is a safe and low-cost intervention. Kangaroo mother care is also protective against many adverse neonatal outcomes, and that kangaroo mother care is associated with a 36% lower mortality rate, a decreased risk in sepsis, hypothermia, hypoglycemia, as well as hospital readmission, and an increase in successful breastfeeding. Located in the top of my poster, top right-hand side, are recommendations for further research. The first study recommended for further exploration into the effectiveness and safety of early onset KMC in unstabilized low birth weight infants. Also recommended from a different study is for research to determine the ideal duration and components of kangaroo mother care. The third recommendation is for the use of kangaroo mother care to be implemented in all hospital facilities, low income or regular income. The overall conclusion of my study was that kangaroo mother care proves to be a successful way to lower the risk of death and complications. Also concluded was that kangaroo mother care is a low-cost intervention proven to provide numerous benefits to neonates of all gestational age. Kangaroo mother care is also linked to a decreased mortality, sepsis, hypoglycemia, and hospital readmission. Located in the bottom right of my poster are my references used, including my 3 studies and my pictures. And thank you for watching, and I also enjoyed teaching you about kangaroo mother care in the preterm neonate population.